Again, while in Ghana, he will address that country's parliament.
Friday, July 10th. Now Obama's going to Ghana. Brings his daughters with him, Michelle. They couldn't make it to D-Day, but they can make it to Ghana. World War II, that was the white man's war. Anyway, have you ever seen a president that moves so fast and doesn't tell anybody what's happening tomorrow? He doesn't tell anybody what's happening tomorrow. Doesn't let anybody know. Doesn't inform you. Bush, Clinton, all the past presidents. The White House correspondent would say something like, for his upcoming trip to Mexico, the president is blah, blah, blah. In a day or two, the Prime Minister of South Gitchigumi is going to be here. Stuff like that. This president goes off on a whole new tear the next day, and he didn't say a damn thing about it yesterday, or the day before, or last week, or maybe even ever, and now all of a sudden it's the big frickin' important thing that you and I and everyone in the nation, yay, the whole entire world must focus on. Obama's doing this today. Who knows what he's going to do tomorrow? He's like, in that respect, it's very strategic to be this way. To be what Sun Tzu called in The Art of War, he called this formlessness. To make your plans unintelligible by the enemy. Now, who would be the enemy? The American people? You know, why can't he tell us what he wants to do tomorrow? Even keep your plans, the darkest secrets, even from your own troops. Because, they could rat you out to the enemy or something, or mutiny. So, what, the American people are going to mutiny or rat him out to the enemy? Exactly is the enemy anymore. It's getting hard to tell. We don't have a war on terror. Okay, so the man likes to remain unfathomable, unanticipatable, undo anything aboutable. Why? Why must he be so sneaky? He has an obvious agenda. It seems like you can put pieces of it together, and then tomorrow some stuff happens that just knocks you right for a loop again. But it's happening faster and faster and faster, and it's getting harder and harder to catch up with it, to keep up with it, to stay ahead of it. This is the object of the game, to anticipate this man. You know what's coming. The fact that you are scoffed at when you say Marxism and socialism, redistribution of wealth, social and economic justice, even slave reparations. You are laughed at by people. You are called a racist. But just watch what the man is doing. He's taking apart everything. He's taking away the floor, which holds the rug that he is going to pull out from under your feet. Make no mistake, Bunky, it's coming. So you better get off that rug and roll it up or something. And check what all that noise is under the floor, okay? And you better do it quick. Now, that's the reason it's so bold and swift, like I keep on trying to tell you. Why he wants it done so quickly. Why everything, healthcare reform, and everything has to be done before the next congressional election, or even the campaign. Because we don't want this to be in debate. We want it to be done and unchangeable. And then the next step is the campaign, where they will tell you that now if you are against making this health plan that we just voted for, the American people asserted that they wanted, now has been started to be implemented. Just we have barely 1 foot in the door, we're at 1 foot in the water, and we've got to put both feet in the water now, and then we have to incrementally, we have to get in deeper and deeper, and anybody who stands against the next phase, one after the other in a sequence, getting us deeper and deeper into the ins and outs of the program, the intrusiveness of it all, and the ubiquitousness of it all, and the expensiveness of it all, and the taxing of it all. Anybody who's against any of this will be regarded as they don't care about the health of the American people. They want the American people to get sick and die. That's another reason I believe that they have to create a crisis with the swine flu. Like Kathleen Sebelius comes on Fox News the other day. She was asked by Bret Baier, do you actually believe, Madam Secretary, that there could be possibly 1 million cases of swine flu in the United States right now? And she looks all coy and shy and says, yes, Brent, we believe it might be possible. And we are preparing the inoculations and trying to have enough. And then a couple of days later, she's like, we are doctors and scientists are growing the virus as we speak. It's like, what? They're growing the fucking virus. You know the flu shot is a dose of the virus anyway. So that's how they're going to spread it, through batches of, heavy doses. And the people that they want to remain healthy, like the military, will receive a shot, but it won't have anything in it. See, and there's only a few people that are going to know about who's getting what. And if mistakes are made along the way, well, that's what they wanted anyway. They wanted a lot of people to get sick so they could hurry up and mandate martially from the executive branch by decree and order a government-run healthcare system to deal with it, to get rid of it. And then people will have to, they'll have to be bedded down, they'll have to be hospitalized, they'll have to be treated, they will have to be quarantined, they will have to be rehabilitated, they will have to be taught in school how not to get the disease, and then they'll have to be lined up and given the shot, and then they will be, some of them will get sick, some of them won't. The disease will continue to spread, and that's how we will make healthcare so important. We'll turn it into a crisis out of nothing. Wag the pig, wag the needle. See? Wag the flu. Coming to a theater near you. Another thing, the swine flu shot, right? Like all flu shots, they're always available at the supermarket. Why can't you go to the supermarket and get a shot? Why do you think, when the whole place, when all the food regulations are in place to hopefully prevent the spread of germs and diseases, why do they issue out a disease right from the freaking sliding glass doors of the supermarket? Come, walk right in, sit right down, man, pop you a hole in your arm and shoot you all up full of freaking germs. And then the next thing you do is you grab your basket and push it on through the damn supermarket to get your, victuals. I mean, is that freaking Twilight Zone-ish or what? Yeah, man, if I see the flu shot going on in the supermarket, I stay the hell out of that place. And I don't go to the hospital anyway. I don't care, man. I have to be a sack of bones and brought there under other than my own 2 feet in order to go to a hospital. You know what I'm saying? I'll be brought there in an ambulance or a helicopter without consciousness, not even knowing that I'm going. That's when you'll see me at the hospital, not of my own volition. That's where all the diseases are. That's where all the sick people are. Stay the hell out of there. And then these nurses and doctors, they walk around in the supermarket too. They go shopping with their nasty germ-covered scrubs that they just wore in the hospital all day, maybe for several days in a row. Let me stop now. I started with talking about how Obama was so sneaky and unpredictable, and how he have to anticipate his moves. That's the most important thing, not to discuss philosophies, but to discuss, to discern what Obama will do next, and to, head him off at the pass, so to speak. Good luck with that.